Welcome to the channel. I am a doctor, and today I'll talk about doctor's warning. These 5 supplements can damage your kidneys. After 60. The health of the kidneys becomes a central pillar of overall longevity once an individual crosses the threshold of 60 years old. As the body matures, the kidneys naturally undergo a physiological transition where their filtration rate begins to decline, even in the absence of chronic disease. This natural slowing of the renal system means that the organs become significantly more sensitive to the chemical compounds we introduce into our bloodstream. While many seniors turn to the supplement aisle to bolster their vitality or manage minor aches, there is a growing medical consensus that certain popular over-the-counter products can inadvertently trigger acute or chronic kidney injury. The tragedy of supplement-induced renal damage is that it is often entirely preventable if the individual understands the delicate interplay between herbal extracts and the aging filtration system. For a person over 60, the kidneys are essentially working with less reserve capacity, meaning that a substance that was perfectly safe at age 30 can become a toxic burden 30 years later. One of the most concerning supplements frequently found in the medicine cabinets of the elderly is high-dose vitamin C. While vitamin C is essential for immune function and tissue repair, the kidneys are responsible for processing its metabolic byproducts, specifically oxalate. When a senior consumes massive doses of vitamin C, far exceeding the daily recommended intake, the excess is converted into oxalate, which must be excreted through the urine. In an aging kidney where the flow of fluid is often slower and dehydration is a constant risk, these oxalates can crystallize and form stones. More dangerously, they can cause a condition known as oxalate nephropathy, where the crystals lodge directly within the delicate tubular structures of the kidney. This leads to inflammation and scarring that can permanently reduce the organ's ability to filter waste. Many seniors believe that more is better when it comes to vitamins, but for the renal system after 60, a megadose of vitamin C is a direct invitation to internal calcification and structural damage. A second supplement that warrants extreme caution is any formulation containing high levels of potassium, particularly when taken alongside common blood pressure medications. Many individuals over 60 are prescribed ACE inhibitors or angiotensin receptor blockers to manage hypertension. These medications have a side effect of causing the body to retain potassium. If a senior unknowingly adds a potassium supplement or a salt substitute heavy in potassium chloride to their daily routine, they risk a condition called hyperkalemia. Because the kidneys are the primary exit route for potassium, a slight reduction in renal function combined with excessive intake can cause levels to spike to dangerous heights. High potassium levels are not just a threat to the kidneys themselves, but can lead to life-threatening heart rhythm disturbances. The kidney is designed to maintain a very tight window for electrolyte balance, and by forcing extra potassium into a system that is already struggling to regulate it, the senior is effectively overwhelming the very organ they are trying to protect. Thirdly, the widespread use of herbal weight loss or energy boosters often contains hidden risks in the form of certain botanical extracts like aristolochic acid or even excessive amounts of green tea extract. While green tea is celebrated for its antioxidant properties, high-concentration extracts used for weight management can be nephrotoxic. The concentrated polyphenols can, in rare but significant cases, cause acute tubular necrosis, which is a sudden death of the cells that line the kidney tubules. Furthermore, many unregulated herbal blends sourced from international markets have been found to contain traces of heavy metals or banned substances that the aging kidney simply cannot process. For a senior whose metabolic rate is already shifting, the introduction of complex botanical compounds can lead to a state of chronic interstitial nephritis, which is a slow-moving inflammation of the kidney tissue that often goes unnoticed until significant function has been lost. The fourth major offender is the frequent and combined use of glucosamine and chondroitin for joint health, especially when the user is also taking non-steroidal anti-inflammatory drugs. While glucosamine is a naturally occurring compound in the body, some clinical reports have linked its supplemental use to acute kidney injury and chronic interstitial nephritis in older patients. The mechanism is not entirely understood, but it is believed that certain individuals have a metabolic sensitivity that causes the kidneys to react to these large sugar proteins as foreign invaders. When a senior who is already dealing with a slightly reduced filtration rate takes these supplements daily, they may be subjecting their kidneys to a constant state of low-level immunological stress. This stress over months and years can lead to a gradual decline in the glomerular filtration rate, which is the primary measure of kidney health. If joint pain is the issue, the doctor often recommends physical therapy or topical treatments rather than systemic supplements that pass through the vulnerable renal filters. The fifth supplement that requires a strict warning is creatine, which is often marketed to seniors as a way to combat age-related muscle loss or sarcopenia. Creatine is a nitrogenous organic acid that helps supply energy to cells, especially muscle cells, but its primary byproduct is creatinine. In the medical world, creatinine levels are used as the primary marker for how well the kidneys are functioning. When a senior takes creatine supplements, they artificially elevate the amount of waste their kidneys must process. For a young athlete with robust renal reserve, this is rarely an issue, but for someone over 60 whose kidneys are already working at 60 or 70% capacity, the extra load of processing supplemental creatine can be the tipping point. It can lead to a false elevation in kidney lab tests, making it difficult for doctors to accurately diagnose actual renal disease, and it can place unnecessary strain on the filtration units called nephrons. Beyond these specific offenders, we must consider the broader biological context of the aging body in 2026. The aging kidney suffers from a gradual loss of nephrons, which are the functional units responsible for the actual work of filtration. By the time a senior reaches their mid-60s, they may have lost up to 30% of these units through simple wear and tear. This means that the remaining nephrons are working harder to compensate for their fallen comrades. When we introduce concentrated supplements, we are essentially asking these overworked cells to handle a chemical surge they were never designed to navigate. The cumulative effect of this workload is what physicians call hyperfiltration injury, where the very act of trying to filter a high-dose supplement causes physical damage to the filter itself. The philosophy of supplement use after 60 must transition from a mindset of supplementation to a mindset of renal preservation. The senior body is a highly tuned instrument that has spent decades filtering environmental toxins and metabolic waste, and by the time we reach the later stages of life, our kidneys deserve a reduction in workload rather than an increase. Every pill or powder that is ingested must be viewed through the lens of the renal system. Before starting any new regimen, the senior should ask if the substance is excreted through the kidneys, and if there is any evidence of its safety in the geriatric population. Most supplements are tested on healthy younger individuals, and the results do not always translate to the unique physiology of a 60-year-old. Furthermore, we must address the role of hydration in conjunction with supplement use. Many of the damages caused by vitamins and herbs are exacerbated by chronic dehydration. When the volume of blood is low, the concentration of the supplement in the kidney tubules becomes higher, and the transit time becomes longer. This allows more time for crystals to form or for toxic compounds to irritate the delicate tissue. A senior who takes 5 or 6 different supplements in the morning with only a small sip of coffee is placing a massive osmotic load on their kidneys. The safest way to approach health after 60 is to derive nutrients from a whole food diet where the vitamins and minerals are packaged with fiber and water, making them much easier for the kidneys to handle. This natural delivery system ensures that the body receives exactly what it needs without the sudden chemical spikes associated with synthetic capsules. The medical community in 2026 is increasingly advocating for a less is more approach to geriatric supplementation. We are finding that many of the benefits promised by these products can be achieved through lifestyle modifications that carry zero risk to the renal system. For instance, instead of taking high-dose vitamins for energy, a senior might focus on improving sleep hygiene or increasing gentle outdoor activity. Instead of relying on joint supplements, they might adopt an anti-inflammatory diet rich in omega-3 fatty acids from natural sources. By reducing the chemical burden on the kidneys, we are essentially giving these vital organs a chance to maintain their function for a longer period. Protecting your kidneys is a fundamental act of self-care that ensures your later years are spent in vitality rather than in the shadow of chronic illness. The kidneys are often called the silent organs because they do not usually hurt until the damage is severe. Therefore, it is the responsibility of the senior to act as a proactive guardian of their own filtration system. By avoiding the 5 supplements mentioned and maintaining a transparent dialogue with a healthcare provider about every substance being consumed, the individual can navigate the later decades of life with their neurological and renal integrity intact. The goal of longevity is not just to live longer, but to live with all systems functioning at their highest potential. And that starts with respecting the delicate needs of the 60-year-old kidney. The intricate nature of the renal system means that once tissue is lost, it is often gone for good. Unlike the liver, which has a remarkable capacity for regeneration, the kidneys are composed of a fixed number of nephrons that die off over time. Every bout of supplement-induced inflammation accelerates this loss, bringing the individual closer to the threshold of chronic kidney disease. In the aging population, where comorbidities like diabetes and hypertension are already putting pressure on the kidneys, the addition of unnecessary supplements is often the final straw that leads to renal failure. This is why the doctor warning is so urgent. It is not about a single pill being a poison, but about the cumulative effect of a daily habit that the body is no longer equipped to manage. As we look at the health landscape of 2026, we see that the supplement industry is more prolific than ever, with marketing that specifically targets the fears and desires of the aging population. They promise a return to youthful energy and a total erasure of joint pain, but they rarely mention the metabolic cost of these interventions. A senior must be a critical consumer, recognizing that the label natural does not mean safe. Hemlock is natural and arsenic is natural, yet they are deadly. The same skepticism must be applied to high-potency extracts and synthetic vitamins. The kidney does not care about the branding or the promise on the bottle. It only cares about the chemical structure and the concentration of the substance it is forced to filter. It is also important to recognize the subtle signs of renal distress that often go ignored. Chronic fatigue and metallic taste in the mouth or swelling in the ankles are not just normal parts of getting older. They are the body's way of signaling that the filtration system is struggling. When a senior continues to take supplements in the face of these symptoms, they are essentially ignoring a fire alarm. The correct response is to pause all non-essential supplements and seek a comprehensive metabolic panel to assess renal clearance. We often prioritize our hearts and our brains because they are the engines of our experience, but the kidneys are the waste management system that allows those engines to run without seizing up. To truly honor your body in your 60s and beyond, you must prioritize the health of your internal machinery over the external appearance of vitality. A healthy kidney is the foundation of clear skin, stable blood pressure, and a sharp mind. When the kidneys fail, the entire internal environment becomes toxic, leading to a cascade of failure across every other system, including the heart and the brain. The choice to bypass the supplement aisle in favor of clean water and nutrient-dense food is a choice for a future of independence. Your kidneys have worked hard for you for 6 decades, and the best gift you can give them now is a lighter load. Reclaim your vitality by being the person who understands that health is not found in a bottle, but in the careful and mindful maintenance of the organs you were born with. This awareness also extends to the interaction between supplements and the myriad of prescription medications that many seniors take. A supplement that seems harmless on its own can interfere with the metabolism of a vital heart medication or an anticoagulant, leading to either a toxic buildup or a loss of efficacy. This pharmaceutical interference is often mediated by the kidneys. If a supplement slows down renal clearance, the other medications in the system can reach dangerous levels. Conversely, if a supplement acts as a mild diuretic, it can flush out medications before they have a chance to work. The only way to navigate this complexity safely is to view the doctor not as a barrier to health, but as a partner in risk management. Another dangerous habit involves the rotation of different brands and formulas without professional guidance. Many seniors are influenced by social media influencers or television personalities who tout a new miracle cure every month. This leads to a state of constant metabolic flux where the kidneys never have the chance to stabilize. The introduction of new and untested compounds on a monthly basis is a recipe for acute interstitial nephritis. By the time the senior realizes something is wrong, they may have induced a level of scarring that permanently alters their renal baseline. Consistency and simplicity are the hallmarks of a kidney-friendly lifestyle. The path to aging with grace is paved with the rejection of quick fixes and the embrace of sustainable habits. There are no shortcuts to longevity that do not come with a hidden price. For the senior who is looking to protect their kidneys, the message is simple and clear. Focus on hydration. Keep your blood pressure in a healthy range and be incredibly selective about what you allow into your bloodstream. The 5 supplements listed: vitamin C, potassium, blends, herbal weight loss, extracts, glucosamine, and creatine represent the most common traps. But the list is not exhaustive. The overarching rule should be that if it did not come from a plant or an animal in its whole form, it must be scrutinized with extreme caution. Your future self will thank you for the restraint you show today, ensuring that your kidneys remain the silent and powerful filters that sustain your life for decades to come. Furthermore, the modern senior must be wary of the siren call of anti-aging protocols that involve experimental peptides or high-dose minerals like calcium. While calcium is vital for bone health, excessive supplemental calcium can contribute to kidney stones and arterial calcification in those over 60. The body has a limited capacity to absorb calcium at any one time, and any excess is sent straight to the kidneys for disposal. In a system where the plumbing is already aging, this excess mineral content acts like hard water in a pipe, leading to blockages and decreased efficiency. The goal is always to achieve a state of balance where the intake of any substance matches the body's actual needs and its ability to process waste. As we conclude this deep dive into renal safety, the emphasis must remain on the concept of bio-individuality. Every senior has a unique medical history, a unique set of genetics, and a unique environmental load. What works for your neighbor might be the very thing that sends you into renal crisis. This is why the one-size-fits-all approach of the supplement industry is so inherently dangerous. Your health is too valuable to be left to the whims of marketing and trends. By choosing to prioritize your kidneys, you are choosing to prioritize every second of your future. You are choosing the ability to play with your grandchildren, to travel, to engage in your hobbies, and to remain a vital participant in the world. In conclusion, the preservation of renal function is the secret key to a long and healthy life. By understanding the specific risks associated with popular supplements and acknowledging the changing needs of the aging body, the senior can avoid the tragedy of self-inflicted kidney damage. This is not about living in fear, but about living with wisdom. It is about recognizing that the 60-year-old body is a masterpiece of biological engineering that requires a different kind of care than the 30-year-old body. By acting as a vigilant gatekeeper of your own health and prioritizing the integrity of your kidneys, you are ensuring that your golden years are lived with the clarity and strength that come from a clean and well-filtered internal environment. Let your health be a reflection of your choices, and let those choices be guided by the knowledge that your kidneys are your most valuable asset in the journey of life. Act today to lighten the load on your filters, and you will find that the rest of your systems will flourish in response to a cleaner, more balanced internal world.